Knowing about menopause is very important since we'll spend 30 to 40 years of our life in it. That's a third of our lives. That's a big deal. I've always wanted to learn about menopause even when I was much younger because I knew I would be getting there. Symptoms that you look for are hot flashes or night sweating. Some people turn red, vaginal pain from dryness. They can have loss of libido from the pain or just general not interested, which can also lead to issues with relationships. And it's not because they don't love someone, it's because the hormones are very different. And then the final one that's very bothersome that everyone talks about is weight gain, which is the bane of everyone's existence. But our lives change when the hormones change. And so it's very important when replacing hormones can make a difference. Now, what do we do about this menopause? How do we figure out if it's there? Well, you have to just kind of listen to your body, and it's good to know ahead of time what to look for, but everyone's different. So we have labs we can do. Sometimes period changes. The periods will get lighter and further apart and off into the sunset. Well, that's easy to make a diagnosis. And once you haven't had a period for a year, you're considered menopausal. But that's only by definition. It's not going to happen overnight for most people. They'll lose one here and one there. And then for some, the hormones are not in the right direction. And so then they bleed more and more and more. And so again, that's not where you want to be either. So we draw labs, we check hormone levels, and those are a little tricky. You have to always be looking. If people are still using birth control pills, they can change the labs. If someone's using Biote from their hair care products, that throws off the labs. And if your thyroid is not right, that can also throw off periods. And so we check all those along with vitamin D, because one of the other things we didn't talk about is bone care and osteoporosis and fractures. Those are things we do not want to see in our lives. Treatments, you have pills, patches, sprays. Now, pill form is a little different because it passes through the stomach, and so it goes through the liver, and it changes the clotting factors for some people, and that's a very important thing to know about. Transdermal is considered pills, patches, and even the pellets that I use for patients are considered transdermal because they're not going through the stomach. That is important to know because there's less issues with clotting factors and hence cardiovascular issues of stroke as we get older. Now, we do know for a long time, and we were all afraid that maybe estrogen was causing breast cancer, but lo and behold, it was us trying to prevent cancer in the uterus when we give estrogen, because our natural cycle is to make that lining fluff up, and then you ovulate, progesterone comes around and protects that uterus. Well, when you only replace the estrogen, it grows and grows and grows. So if someone has her uterus, I find a way to use progesterone. Now, mentioned birth control pills. That would say, how do I know I could get pregnant or not get pregnant? You don't want to be pregnant at 48 years old. So if you're still having periods, it tells me there's some estrogen around, but it doesn't tell me if you're ovulating, and it doesn't tell me anything really about timing of when things are going to stop and that you won't need protection. So that's where I use the Mirena IUD a lot, because that will give you good contraception. It just goes in the uterus and sits there, and you don't have to do anything, and now they're good for 8 years. And surely 1 or 2 of those, and we can be in menopause no matter what age you are. The hormone that we talk about also is testosterone. And even though we think of it as the boy's hormone, we all have some, and some people really miss it. And that can make a big difference in terms of libido, in terms of fatigue. The emotions of this whole process are estrogen and testosterone driven. So with testosterone, we have compounding creams, but if you really need a level, I used to use the creams a lot for patients, but we stopped getting good levels because we were not getting good absorption. And so I've switched a lot of people to pellets, and those go under the skin. It's a little 1/4 inch steri-strip incision. And I especially like the Biote pellets because I feel very comfortable in the quality of the dosing and the computer program that helps me figure out the dosing. And that has really helped. So depending on what kind of symptoms you need is depending on what we use. So if you just need something for hot flashes and night sweating, you may only need some estrogen and or progesterone if you still have your uterus. But if you're having the other symptoms and we're considering the pellets, then we can add estrogen to the pellet. Now, always, always, if you have a uterus, we use progesterone. And my patients and I, we just are like hound dogs to make sure. Talking back about the estrogen not causing breast cancer, the most biggest thing I try to get people to do is make sure they're on time with their mammograms. Screening for breast cancer. We're not going to cause a breast cancer with our hormones, but we sure don't want to feed a breast cancer estrogen. And so it's very important to get those done. And it's easy to forget. You get busy, it gets delayed. When you call, it's 2 months later. Doesn't matter. That mammogram has to be done because that's a very important part of the screening and of good health care. Lastly, the vaginal pain part is just from low estrogen. And for years and years, we were giving a cream that was messy and no one ever used, and they never needed a refill because they barely got the first tube filled. But we have better preparations now, so we can do just vaginal therapies if you're not having any of the other symptoms, but just vaginal dryness. The problem with vaginal dryness is when it comes, it doesn't go away, and most of the time it gets worse and worse. Hot flashes, night sweating, most of those will go away for most people, but the vaginal dryness is a big, big troublemaker. And it sets you up also for bladder infections. And as we get older, we don't drink as much. Bladder infections can make you really sick with sepsis. So it's a very important part of good health care long term. Another way of treating the vaginal dryness, and one of my favorites, is my Mona Lisa laser. And it drills little tiny microscopic openings in the walls, and the healing of process that you build up the collagen, you get the moisture back, you get the function back, and that too will help with the bladder function as well. So one of my patients calls it the Mona Lisa smiles, and we love that. So it's important to sit down, and go over your symptoms, see what the options are, what your family history is, what your medical history is. Women don't talk about menopause even in 2024, and I think that's a shame. I've been trying to get everyone to talk about it for years and years. We should be preparing ourselves so that we know when things are coming, and we shouldn't be afraid. It's a very liberating time.